Hi, my name's Kirsty. I am an Anatomical Pathology Technologist here at the Nottingham University Hospitals. My average day as a technician starts with getting the post-mortem room ready. So we get in all the patients that are on the list for that day. We make sure that we've got the correct ones, we check their ID, check on their property, and then make sure we have all our equipment ready. Once we've had our morning briefing after that, so all the staff know roughly what's going on for the rest of the day, that's when I can start my work. So I follow the instructions from the pathologists who pop over from histo to us. And we can do a variety of different things, so we might have a lot of invasive post-mortems that day, or we might not have so much invasive work. A lot of our patients have a CT scan now as part of their post-mortem, which is actually brilliant because it reduces the amount of invasive things that we need to do for them, so much better for their families, and that can give a lot of results for them as well. So it completely varies every day, and it varies throughout the year. Winter generally is going to be our busiest times, but even now in summer we're still seeing not too low numbers. Once we've done all the work requested for our pathologists, we make sure that all our patients are sewn back neatly together and they're all beautifully nice and clean, and we get them away so that they can go back into the fridges, and then that will be most of the morning of our work. So in the afternoon we can do a variety of different things. We are a centre where we can do forensic post-mortem, so often that's what might happen in the afternoon if there needed to be one. But we can also assist the rest of our colleagues, so this will be admitting patients into our department, and so that's from both the hospital and from the community, releasing them to the funeral directors who are now going to look after them, possibly getting them ready if people want to come and visit them as well whilst they're here. Another big part of our job is actually that we do welfare checks on our patients, so we try to check them sort of every 7 days, just see how they're getting on, is there any signs of deterioration, maybe they've got some cannulas in that have started leaking, we need to clean them up and sort that all out. So it's just about making sure that we're monitoring how everyone is doing, and it means that if anyone does want to come and visit them, then we've got really good up-to-date information so that we know that we can discuss with them if there's anything that we feel they need to know about. And it might just be that their skin's getting a little bit dry, so it looks a bit unusual. So it's it's quite common, but if you're not working in this industry, then you probably don't expect that kind of thing. So we know how that we can speak to families just to let them know that actually this is the way that they're looking, and are they still happy to come and see them. If anyone wants to visit a patient whilst we're looking after them, and then we'll do our very best to do that for them. We bring them into the rooms that we are in here, so they look far less clinical than anywhere else in our rest of our department and the rest of the hospital. They essentially are, we put them in on a sort of a trolley that actually ends up looking a bit like a bed, so we make sure we've got a pillow underneath them and sheets around them so they can't see underneath the metal tray that they're lying on, or if they've got any like central lines in their neck, we make sure that all the sheets are folded around so they can't see this. We can also make sure that if they've got injuries to their face, then the family come in the side that they're not on. It's all about trying to make sure that this is like the most positive experience for the family themselves. Because we'd have patients who come to us from the community that often really quite unexpected deaths, so families can come to us and can be really worried, really anxious, very much they just want to see their loved one. So it's great that we have the facilities that we can do that for them and sort of put their mind at ease a little bit, that they are sort of very well looked after and cared for whilst they're here. So I guess my favourite part of the job is sort of the patient care side of the job, and in particular the reconstruction after post-mortem. So it means that we suture any incisions that we have made closed, but also for injuries that we can suture closed as well, making sure that they're all nice and clean, sort of the hair is washed and they're just looking the best that we can make them. Sometimes particular injuries can be quite challenging, so it's quite nice to sort of have to be able to try and actually make people look really presentable, especially if that's the case. But also when we're getting patients ready for their families to come and visit, it's really lovely to make sure that they're looking great, that their hair is nicely combed, that we've got all their eyes closed and their mouth closed, and they're just looking really peaceful is what we aim for. So when families come in and say like, oh yeah, they look lovely, you know that you've done a great job, and that's like a real good moment for us.